Light therapy is the #1 non-invasive treatment now preferred by therapists for all things having to do with skin and soft tissue. Light therapy helps increase the production of collagen, smooth the appearance of wrinkles, reduce age spots, and brighten the skin. Additionally, light therapy is also used to clear acne, treat rosacea, and help relax muscles as well as provide local pain relief. Light therapy is the ultimate in anti-stress therapy, allowing the body to embark on a wonderful journey into the world of relaxation, a sense of well-being, and calmness. Scientists and clinicians know that light therapy increases local levels of nitric oxide, and that nitric oxide improves memory, behavior, and mood, partly by helping nerve cells talk to each other. Nitric oxide also helps the immune system. It reduces inflammation, increases endurance and strength, as well as increases blood flow at the sites of application. To learn more, let's take a closer look.
Infrared light penetrates the epidermis, dermis, and subcutaneous layers of the skin, releasing nitric oxide molecules from hemoglobin, relaxing the blood vessels, and thereby increasing local circulation. Fine lines, wrinkles, age spots, and other skin damage from long-term sun exposure, repetitive facial expression, and the normal aging process affect the skin by decreasing or compromising circulation over time. It is widely known that compromised local circulation decreases oxygen in cells. When this occurs, it creates scar tissue. However, increasing oxygen with light therapy has beneficial effects. By increasing the available oxygen through light therapy, fibroblasts create more type 1 or good collagen and less type 4 collagen. Additionally, light therapy can stimulate the creation of new blood vessels through angiogenesis while promoting endothelial cell growth. The result, a healthier, youthful-looking skin with fewer fine lines, wrinkles, and discoloration.
Our skin is the first thing people see. Conditions such as acne vulgaris and cystic acne respond well to the application of infrared light.
Extractions create micro wounds. And if followed by light therapy to increase circulation, this will promote faster healing and less chronic inflammation.
Cystic acne is a bacterial infection in the dermis. Although antibiotics are helpful, their overuse is well recognized and problematic. Cystic acne infections must be cleared through lymph cells.
Improving blood flow and reducing inflammation should help antibiotics better reach the dermis. Light therapy increases lymphatic circulation and is well documented.
Modern day-to-day living can contribute to unseen inflammation deep inside the body. Inflammation is the underlying cause of nearly every degenerative disease and pain, with collateral effects on many surrounding areas. This can impact the overall quality of life for a large segment of the population. Although short-term inflammation is a normal part of the healing process after injury, chronic inflammation must be reduced before wellness can occur.
Light therapy is the effective tool for reducing inflammation by increasing nitric oxide levels to aid in reestablishing homeostasis, thereby allowing the body's built-in healing process to begin, aiding in a better quality of life.
Upper back, neck tension, and tightness are common. In today's busy world, desk-bound work with less than posture-friendly conditions can mean this tightness often decreases blood flow to muscles and nerves. Light therapy used prior to massage reduces muscle stress and increases the effectiveness of the massage and requires less physical effort from the therapist.
Light therapy releases nitric oxide from hemoglobin, which increases vasodilation as well as restores oxygen levels to muscles and nerves and therefore reduces pain.
Light therapy devices are FDA cleared to increase circulation and reduce pain. Many painful conditions are a result of a lack of local circulation, such as peripheral neuropathy, plantar fasciitis, and golfer's elbow, to name a few.
These live images were taken 20 minutes apart from the same individual using standard finger prick technology and a dark field microscope. The initial image clearly shows baseline clumping of red blood cells. Here, light therapy was applied to the navel area for 20 minutes. Blood passing through the navel area returns to the same spot in about 19 seconds. In the second image, after only 20 minutes of light therapy, all cells are more mobile and less adhesive. The entire body benefits when light therapy is used to improve circulation. This improvement is sustained for several hours.
Utilizing light therapy offers a host of benefits to practices. Primary among these is use as an unattended therapy, allowing clinicians to treat multiple patients at once. Therapists who use light therapy with clients prior to actual treatment are able to maximize scheduling and improve outcomes. As a result, clients return more frequently because they are treated more quickly as well as effectively, seeing and feeling results sooner. Additionally, it's not uncommon for clients to refer friends and family members to clinics to discover this beneficial new treatment that is changing lives daily.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. The muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near-infrared light penetrates about 20 to 100 millimeters. Near-infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level. These are generalizations because the more red cells with hemoglobin in the path of the photons, the shallower the depth of the penetration. Remember, hemoglobin absorbs the near-infrared light energy, thereby releasing nitric oxide. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following. Improved sensation, which offers better gait and balance when walking. Reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities. Increased oxygenation, which acts to reduce inflammation. And finally, increased circulation, which offers the body decreased wound incidences and shorter healing times.